Hi, class. My name is Agnes Montgomery, and my topic is on education as a social determinant of health. And to begin with, I would need to define what education is, and because my audience is composed of nurse educators, so I'll take it for granted that you all know what education is. And basically, from my talking points, I will be referring to education as an acquisition of knowledge, knowing how to do something. And basically, what we get as education when we go to school, we learn stuff. The things we learn in school are supposed to help us in life by giving us ideas or skills on how to do certain things or how to go about doing our jobs that we train for. So I'm talking about formal education. Formal education is where we go to school, knowledge is imparted, and we acquire the knowledge as students. And this is just the basics of knowledge that we learn in school. That knowledge, we are supposed to transform it into something that we can live by. And I would also talk about civic education, like how do we just relate with each other? What is it I know that would help me? I really miss the word here, but I want to say help me go about finding what I need to know or what needs to be done for me, like what are my rights or what are my responsibilities. And I would also talk about education as a social skills acquisition. Like, this is the only name I came up with from watching the video, Mr. Corey. Mr. Corey talks about his mother teaching him how to iron his clothes. That makes him presentable when he goes outside. And just from that act of his mother teaching him how to iron and be presentable, he carries that one on to his family and even his co-workers. And education also does not stop in the classroom. Education does not stop where it is that it was given. So I'm talking about education as a universal thing. Education transcends the classroom, transcends the environment where you are. Education transcends the age for which we get it, we are supposed to be in school, in other words. Education goes on for a lifetime. Whatever we learn in school should be able to take us throughout the life span. Our life extends through our life. So, formal education, how I relate it to social determinants of life. To me, as a person, of all the social determinants of life that are listed on the paper we have: economic stability, neighborhood and physical environment, food, community and social context, and healthcare systems, I think education tops them all. And I'm saying this because with education, I know when to do what? I know when my life is okay, when I'm feeling okay. And if I'm not feeling okay with this education, it will have made me know that if you think you have a cold, you should tell somebody or you should go seek medical help, or that's just really basic. But when you have education, you are literate. When they advertise stuff, when they put posters around, you can go and read them. Like when you go to the public library, there's always very many posters at the entrance. You can read them, you can get some information there. So if you are looking for a job, you can find a job from there. If you're looking to buy some used stuff, you can find them there. And if you're looking for services like child care, somebody to come help you, you can find them there just because you're able to read. And early childhood education and vocational training and higher education all set us to start at a certain level in society, in life. So with education comes economic stability. That goes without saying. You will, once you get education, you can get some employment. Once you get employment, you get an income. Once you get an income, you can feed your family. And when you can feed your family, you can now decide what kind of food they're going to eat. Are they going to eat the food that your money can buy, or they're going to eat the healthy food? And this is where people always go back to school, even if they've gone to school. You see this the schools advertising colleges on TV. They always tell you to go back to school, because when you go back to school, you get an advanced certificate, and they tell you with that advanced certificate you're going to make so much more money in the year. And the low income people tend to have more than one job so that they can make ends meet, barely actually make ends meet. So when they go to school, they get educated, they have this knowledge that they can do something, but they can build on that knowledge that will make their life more bearable. So when their life is more bearable, they can actually decide that my family is going to eat healthy, and they can eat healthy because they can afford it, as compared to somebody who has a lower education level, who does manual labor, and the income they have can only afford to buy them a certain type of food. Most of the time we go to the supermarket, the aisles with the cheapest food are mostly the aisles with the foods which are more unhealthy to us. So without education, you also lose that power to decide. When you're going to go to the gym, you can't go to the gym because you are running from one job to another one. Or if you can eat healthy, you can't eat healthy because you don't have enough money to eat healthy. You can't live in certain neighborhoods, you can't live in certain houses because you can't afford to pay for them. And as was with the case in Durham, I think last year, where the people living there, the houses had, I think, carbon monoxide, mold, and stuff like that. So the people had to be housed in a hotel while the county renovated those houses. So because those were low income people, they had to go through that health hazard situation. But if they had better education, then they would have better choices. They would make better choices for them and their family and their community. And I can say so many things about how education helps us live healthier lives, like forever. So health education in itself is very important. People need to get educated about health. In that way, they would stay with that knowledge throughout their lives. Like if you were trained to eat healthy, most of the time you'll eat healthy. Even when you are in a nursing home, you will still want to eat healthy. And for question number 6 about what I would like to do, I will still pick education as a social determinant, and I think education needs to be really emphasized on here. I know there is this policy about no child left behind, and so many other programs have come around to help keep the child in school. So education is really my pet peeve. Once you know, then you can do. So I would like to continue emphasizing on education, and I think I would provide some kind of education, continuing education. For example, as a nurse, I would give education to my patients, sometimes to my colleagues when I see them doing some crazy stuff, and even just my family and friends. Just because I'm in the medical field, most of the time they ask me questions, health related questions. So I can't answer all of them, but I will always tell them I will get back with them. And then I will go and find out. I can find out from the internet. I can find out from my colleagues, the doctors we work with. I can find out from them. I would continue to provide enlightening experiences to the people I come in contact with. And education is an investment so that disease can not happen. Once we get educated, we will keep the disease at bay. And when the disease arrives, we know what to do about it and how to keep it at that level or eradicate it completely. COVID-19 case in point. So many people are scared to take the vaccine, still scared to take the vaccine just because they don't have the right type of education. Of course, I know some people really know what it is all about, but some of us don't know the basis on which we need to get that vaccine. And you can see on TV, in the news media, on the radios, that all counties are now trying to get to people through at the levels where they are at. So that's what I would like to do, like get to people at the level where they are and start from there. Like my pastor says, like, don't tell somebody drinking is bad for you, smoking is bad for you. They already know smoking is bad for them. So why tell it to them? Tell them something new that they don't know. For example, you ask them how they feel about smoking, and if you can replace that feeling with something else that is more healthy. And education, education, education. Thank you.